to the stories topping the news. Building a strong foundation for education will tell you how. Jamaica in national emergency due to the chikungunya virus outbreak, and a Texas nurse receives plasma from an Ebola survivor. Good afternoon. Welcome to the ZIZ Midday Newscast. Today is Wednesday, October 15th, 2014. I'm Ebony Brandon. Now we take a look at the news developments in detail. The St. Kitts and Nevis National Education Foundation is a vehicle through which the dreams of many students, teachers and budding professionals can be realized. These were the words of Minister of Education, the Honorable Nigel Carty, who explained the initiative will provide personal financing which will help students raise their level of academic achievement and meet the challenges of a competitive global environment. The minister stated that his ministry continues to work on the premise that a strong education system is fundamental to strengthening the economy and raising the standard of living.
This ministry initiative has therefore been designed to remove the financial stumbling blocks which could prevent students desirous of accessing higher learning from pursuing their dreams and educational goals. Hence, this foundation is yet another investment in the human resource development of our Federation, and it is our expectation that the young people will avail themselves of this opportunity to achieve nothing less than excellence in their chosen fields of endeavor.
The Honorable Dr. Earl Asim Martin, Deputy Prime Minister, stated that the establishment of the Education Foundation marks an important moment in the history of the nation.
Education has played a very important role in our evolution as a nation. Education has always been important, of course, in all societies and in all individuals.
Sienna Benjamin Mack, guardian of the SKNNEF, stated that the foundation is unique from other foundations. The foundation will offer students an opportunity to receive excellent public education and encourage innovation and greater experiences in the teaching learning environment. It will also provide educational grants to non-profit organizations and design special funding initiatives to address the community's critical educational challenges. The Education Foundation was launched on October 11, 2014. Head of the Nevis Disaster Management Department, the NDMD, Lester Blackett, says that although Nevis did not suffer any major damage from the passage of Tropical Storm Gonzalo on the 13th of October, the experience should serve as a reminder to Nevisians that the Atlantic hurricane season is not over and that they should pay greater attention to the weather daily. Blackett's comment came when he spoke to the Department of Information about the effects of the storm on Nevis. He said it generally seemed that persons were not prepared. The disaster management official also spoke to the importance of awareness and reminded persons of the deadly 2013 Christmas rains in other parts of the Caribbean and a deadly flash flood incident in Nevis, which he believes should serve as other learning experiences for Nevisians. In regional news this hour, Jamaica's Prime Minister Portia Simpson Miller says the country is in a national emergency over the outbreak of the mosquito-borne chikungunya virus in the country. The disease has spread across the Caribbean region after initially appearing in St. Martin in late 2013, but it has hit Jamaica particularly hard. Miller said she sympathized with those across Jamaica who came down with the painful illness. She also said that the government called on $4.5 million in state resources for national health emergency response, with the objective of reducing mosquito breeding sites by starting with the worst affected areas. After only infecting a handful of people over the summer, there have been almost 800,000 suspected cases in the Caribbean region, with the majority in the Dominican Republic. In St. Lucia, the former Chief Medical Officer Dr. Stephen King has called for a flexible response to the Ebola threat. He has also expressed concerns that healthcare workers who may be required to treat infected persons could be at risk. DBS's Alex Busquet has the details.
World Health Organization officials say the death rate in the current Ebola outbreak has increased to 70%, and the organization says if the global response to the Ebola crisis is not stepped up within 60 days, a lot more people will die. The Ministry of Health here says it is stepping up the island's surveillance systems and state of readiness in the event that the deadly virus spreads here. And former Chief Medical Officer Dr. Stephen King was asked by journalists about measures to screen arrivals at the airports.
Really what's needed is intelligence. We need to know where people are coming from. where they've been in the last 21 or say the last 30 days. We need to know that so that we can sort of triage and make sure people who are coming, who've had possible contact with people with Ebola, that we can treat them differently from travelers who come from other parts of the world, because travelers from other parts of the world are not at the same risk as travelers coming from areas with Ebola. So to me, it's really working with the intelligence services, working with the airlines to know who is coming from where and where they are landing and when they are landing.
In that way, Dr. King says, there can be a flexible response to the virus. The former chief medical officer feels one can never do enough in the fight against Ebola, which is wreaking havoc in West Africa. Cases of the disease have also surfaced in the United States and Europe among healthcare workers.
Healthcare workers are at great risk, all of us, mortuary staff, clinical staff and so on. So of course it's of great concern to us. Mind you, we have an ethical responsibility to deal with people and handle patients who are sick. So we need to walk that line, which is why it's so important for us that our government puts the right things in place so that we can be assured that we are as safe as we can be. Even though the risk will never be zero, but we can minimize that risk.
The World Health Organization estimates that in the next 2 months, there could be up to 10,000 cases of Ebola per week. The death toll so far from the deadly virus is over 4,400. For the DBS News World, I am Alex Bousquet.
Internationally, the 26-year-old nurse who caught Ebola while treating Thomas Duncan in Dallas, Texas, has received a plasma transfusion donated by a doctor who survived the virus. We hear more in this report.
26-year-old Nina Pham was among about 70 staff members at a Dallas hospital who cared for Thomas Eric Duncan, according to medical records.
We wish this individual had not been infected, and we're concerned that there could be other infections in the coming days.
Pham has not been able to point to any specific breach in protocol that led to her infection. Meanwhile, in Germany, a United Nations medical worker who was infected with Ebola in Liberia has died. The 56-year-old man, who has not been identified, tested positive for the virus on October 6th, prompting Liberia's UN peacekeeping mission to place 41 staff members under observation.
I am, of course, sorry for him. The man was young, and he got infected because he wanted to help those affected people over there.
Human testing of an experimental Canadian-made Ebola vaccine began on Monday, with federal officials saying the drug could be shipped to West Africa within months if it proves successful.
The Phase 1 clinical trials that we are announcing today will be important in assessing whether the vaccine is safe for use in humans pre-exposure. It will also help determine the appropriate dosage or how much of the vaccine is needed to give people immunity.
Ebola has killed more than 4,000 people, nearly all of them in the West African countries of Liberia, Sierra Leone, and Guinea. And a World Health Organization official is warning that there could be thousands of new cases per week unless the response to the crisis is stepped up. Matthew Burgoyne, Associated Press.
Protesters call on the Nigerian government to do more to bring back more than 200 girls who still remain captured by Boko Haram. They are angry about the government's failure to ensure their release. We hear more in this report.
Protesters want to meet President Goodluck Jonathan. They hope he can tell them why more than 200 girls abducted by Boko Haram in April still haven't been found. Soon the police move in. Organizers of the Bring Back Our Girls campaign demand to be let through. Yakubu Keki waits quietly. His 2 daughters were abducted 6 months ago in Chibok.
Almost lose hope. The mothers now at home. If you see them, you will pity. Almost a reasonable number of them now are in the hospital because of heart attacks.
People try to force their way through the barricade, but the police have their orders.
They keep saying they want answers. They want to know where these girls are and what the president is doing to try and rescue them. But they've come across resistance. The police say they aren't allowed to go any further.
18-year-old Rebecca Isaac is one of the few girls who escaped from her captors. The experience has made her scared of going back to school.
They put me in a car. I prayed and I said, God help me, because these people are bad people. They're not good. We kept on moving. I finished my prayer and jumped out of the car and I started running.
Some people believe the government doesn't care anymore, but officials say they are doing everything to rescue the girls. They also say the timing of the rescue mission has to be absolutely right.
It's not going in and getting them out dead. the Nigerian Armed Forces and all the security apparatus that we have had the capacity to walk in there and shoot everybody. But what do we gain? We gain nothing. We lose lives, innocent lives.
So parents, friends and family are left asking, if the government's rescue plan is not to attack Boko Haram, then what is? Harumutasa, Al Jazeera, Abuja.
Now for a look at today's weather, we'll see sunny skies accompanied by patchy clouds. Temperatures are expected to reach a nice high of 30 degrees with a low this evening of 25 degrees. Winds will blow from the east-southeast at 10 to 15 miles per hour. Tonight we'll see partly cloudy skies with winds blowing from the east at 5 to 10 miles per hour. That brings us to the end of the ZIZ Midday Newscast. Join us this evening on radio at 6:30 p.m. and right here on ZIZ Television, Channel 5 at 7 for the evening news. These stories and more in detail. I'm Ebony Brandon. Have a lovely afternoon.